Hi viewers, this is Dr. Mashhood today with another video. In this video we're going to talk on one of the most important medical causes or problems which remains undetected in the developing world. We are talking about hypothyroidism. Hypothyroidism happens when the thyroid hormones are not produced in sufficient amount in the body so as they start giving signs and symptoms of hypothyroidism. The thyroid hormones are produced by the thyroid gland, which sits in the front of the neck. Now, the importance of thyroid hormones is essential because they are involved in the metabolism of the body. Metabolism is the method by which the body makes energy. So, if the thyroid hormones becomes less, the metabolism becomes less, and the person has less energy. So they become lethargic. They become fatigued easily. And when the metabolism becomes less, the body cannot metabolize the diet one is taking, hence the body weight starts increasing. So there might be people who might just notice that over the last few months they've started to gain weight even though the diet is low or the same as it was before. It's not because they have changed their diet, it's because the body cannot metabolize what they're eating or drinking because of lack of or low amounts of thyroid hormones. Thyroid hormones are produced by the thyroid glands, which are in front of the neck. Now, there are three ways in which thyroid hormones can be low. The first one is simple, is if somebody has an unbalanced or incorrect diet. That means they are taking less amounts or no amounts of iodine or iron. Iodine and iron are both required for the production of thyroid hormones. So if there is less iodine and less iron in the diet, there would be less production of thyroid hormones by the thyroid gland. The second reason is if the thyroid gland itself starts producing less amount of thyroid hormones. That can happen in conditions such as Hashimoto's or goiter. The third cause of hypothyroidism is if the thyroid glands are not getting appropriate signals from the brain to produce thyroid hormones. The signals from the brain originate from pituitary gland, which is a very small gland, sits in the brain, and it gives signals to the thyroid gland to produce hormones. So if there's a problem with the pituitary gland, which could be because of a number of reasons, then it won't be sending signals to the thyroid gland to produce thyroid hormones. Among these three, the first one, which is the most common one, can be easily correctable, which is imbalance, inappropriate diet, a diet which not contains enough iodine or iron. So if somebody has symptoms such as increased body weight, increased depression, and in females it can cause irregular periods, it can cause dry skin. Now the importance of depression is, now it's an easily fixable problem, hypothyroidism. But the patient, if they are having depression, it not only affects them, but it also affects their relatives or the loved ones. So this needs to be dealt with. Again, if somebody starts gaining weight, it again affects their mental status. They might be in complex that why are they gaining weight instead of doing the exercise. It's just because of a simple reason that because they have lack of thyroid hormones. So what are the foods which are rich in iodine? The richest foods are the seafoods. Seafood contains a lot of iodine in them. Along with iodine, the iodized salts are a very important source of iodine as well. Iron. Iron is present in sufficient amounts in red meat, beans, and dry fruits. There are two particular foods that one should avoid in hypothyroidism, which are cabbage and cauliflower, because it affects the production of thyroid hormones. So in spite of a good dietary habits which contains sufficient amount of iodine and iron, if the patient still has low levels of thyroid hormones or increased levels of TSH, which is thyroid stimulating hormone, then they should start taking man-made or synthetic T3, T4s. T3, T4s are the medical names for thyroid hormones which actually work in the body. So one of the most commonest drug or medication is the levothyroxine. And again, the dose of levothyroxine is weight dependent. But it's imperative and really important to take levothyroxine if somebody is having low levels of thyroid hormones such as T3 and T4. So how do we detect a thyroid hormone deficiency or low levels? Is by first of all doing a test such as TSH or thyroid stimulating hormone. If on the blood test the TSH levels are really high, that means the body is giving signals to the thyroid gland to produce thyroid hormones, but they are not producing amount. Hence the signals keeps on going in. Because the levels are so low of the thyroid hormones, the feedback cannot go to the brain to stop producing TSH or stimulating hormones. Hence it's a way of detecting somebody has hypothyroidism. The other way is to calculate the T3 or T4 levels. But TSH by large is the first and the simplest way of finding out if somebody has hypothyroidism. It's easily fixable issue, but the thing is you have to detect somebody's got hypothyroidism if they're having symptoms. The reason it becomes a problem is because it remains undetected for a long period of time, especially in developing world. So if you have any symptoms such as increased body weight, depression, mood swings, dry skin, or you start having irregular periods, please suspect hypothyroidism and do the relevant test. The rest of the description is present below the video.